Hey, what's up everybody, and welcome back to the channel. And today I have a very special topic for you today. And what we're going to be talking about is metabolic syndrome X, what it is and how you can beat it. Be sure to check out the description because there are going to be notes from the video there. Plus there are also going to be some free resources down there, especially if you want to get started with a ketogenic diet. You can sign up. There's a free plan down there. Before we get started today, be sure to check out those free resources and let me know if you have any questions. Now, if you find this video helpful, please be sure to like and subscribe to the channel because it's my mission to help as many people as possible overcome their chronic health conditions. And by sharing and liking, you help me accomplish that mission. So thank you so much. Now that I've got that over with, let's get into the topic for today. It turns out there's a silent, unrecognized epidemic in folks without diabetes who have high insulin levels and corresponding to early heart attacks. Now, I know that this can sound scary, but there is some good news with this, and that's what we're going to be covering, so make sure you stay till the end. Called Syndrome X, and Syndrome X is also known as insulin resistance. Now, there's a lot of talk about insulin resistance, what it is, what the causes are, and how you can treat it. So I just want to give you a general overview so that you can understand that this is something that happens 10 years before you get diabetes and the warning signs that come along with that. And a lot of these chronic issues, it's just like one day that they happen. So we need to develop a system and develop an awareness so that we can prevent these chronic diseases from happening. And that's the purpose of this video. Now, it is estimated that a huge part of the population has Syndrome X. Not only does it trigger weight gain, so if you have excess weight, excess adipose tissue, then this can be one of the reasons why. Fatigue, which a lot of people have, a lot of people are really constantly stressed out, and that affects your sex hormones, it affects your energy systems, and it also affects your insulin and glucose sensitivity. And then other symptoms like high blood pressure, but most folks do not even know that they have it and have never been tested for it. So we're going to go over the testing for this as well. Metabolic syndrome refers to the presence of a cluster of risk factors specific for cardiovascular disease. So we're going to go through those risk factors in this video. Metabolic syndrome greatly raises the risk of developing diabetes, heart disease, stroke, or all three. Now, these are the most common chronic conditions that we experience not only in the US, but across the world. And with heart disease being the #1 killer of people, it's essential that you understand what is going on. Now, if you haven't seen some of my past videos about cholesterol and what the real root cause is going on with high cholesterol and it blocking the arteries, then go back and check out that past video. It has some really good stuff in there that explains exactly what's going on. According to the National Heart, Lung, and Blood Institute, the cluster of metabolic factors involved includes abdominal obesity. This means having a waist circumference of more than 35 inches for women and more than 40 inches for men. An increased waist circumference is the form of obesity most strongly tied to metabolic syndrome. So if you hit that, that is one criteria. Now, high blood pressure of 130/80 or higher. Normal blood pressure is defined less than 120 for systolic, which is the top number, and less than 80 for the diastolic or the bottom number. Now, high blood pressure is strongly tied to obesity. So these kind of go hand in hand. A lot of the times that has to do with kidney function and cortisol. Now, it is often found in people with insulin resistance that they have a high correlation with high blood pressure. Now, impaired fasting glucose. This means a level equal to or greater than 100 when you're fasting. Now, when I'm working with people, I actually like to see it around the 75 to 80 range. That tells me that your blood glucose is really stable when you are doing fasting, when you are eating foods, that it's not going way too high. If it starts to creep up even into the 90s, that's when we know that there could be potential cause for issues. Now, high triglyceride levels of more than 150. Triglycerides are a type of fat in the blood, and a lot of the times they can actually indicate inflammation if you have high triglycerides, not necessarily that you're eating too much dietary fat. Now, low HDL cholesterol, less than 40 milligrams per deciliter for men and less than 50 milligrams per deciliter for women is considered low. This is the high type of cholesterol that you get from good fatty foods and can be supplemented through fish oils and various other supplements. The NHLBI, sorry, I know that that's a long acronym, and the AHA, American Heart Association, recommend a diagnosis of metabolic syndrome when a person has 3 or more of these factors. So now you can look at the aforementioned. So that looks like abdominal obesity, high blood pressure, impaired fasting glucose, high triglyceride levels, and then low HDL. That can be risk factors and actually say maybe we do have some of this insulin resistance or this syndrome X. This form of insulin resistance in non-diabetics often underlies not only weight gain, but episodic or chronic tiredness and high blood pressure, high cholesterol, poor thought process, mood swings, constant hunger, high triglycerides, and elevated uric acid are also concerns and factors that you want to take into account when you're looking at this insulin resistance or syndrome X. Here are some other risk factors that go along with it, and those most are closely tied to metabolic syndrome. Now that looks like age. You're more likely to have metabolic syndrome the older that you are. Body mass index greater than 25, so that kind of ties into that obesity factor. The BMI is a measure of body fat compared to height and weight. Personal or family history of diabetes, women who have diabetes during pregnancy, gestational diabetes, or people who have a family member with type 2 diabetes are at greater risk for metabolic syndrome. Smoking, history of heavy drinking, stress, being past menopause, high carbohydrate diets, that's where the ketogenic diet comes in really helpful, and a sedentary lifestyle. Now, the mechanism that leads to syndrome X happens when the membranes of the cell where the insulin receptor lies is damaged. So then insulin cannot work properly, so the body sends out even more insulin to try to lower the blood glucose. Now, the insulin in turn triggers hunger, so the person eats more. So if you feel like you're eating a lot but you never feel full, then you really want to take a look at your diet. Are you eating way too many sugars? Are you eating way too many carbohydrates? And do you have these risk factors? Since the insulin does not work on the cell receptor to convert the sugar to energy, the sugar becomes stored as fat, leading to increased weight gain. Now, the innocent victims are always hungry, craving carbohydrates, and gaining weight. So if this sounds like you, really take a look into this. Now, a short-term solution is a carnivore diet of high-quality protein at every meal. This explains why people with syndrome X or insulin resistance feel well on the Atkins type diet and do not have arteriosclerotic complications, which is really neat to see. So people have actually been doing kind of a carnivore-based diet in the past, which somebody in the comments brought this up, which thank you for that it's just been named something differently in the past. But put them on fruits, whole grains, pastas, and breads, and they will feel awful and actually increase their risk of early heart attack through insulin triggering and with a high glycemic diet. So what that's saying is we really want to avoid fruits, whole grains, pastas, and breads because those can actually cause this disease process to be even worse. Even though fruits and salads are healthful, until we actually have the membrane receptors corrected on the cell so that they can actually take in the glucose from these foods, they do best, the people with this issue do best on meat because it triggers the least amount of insulin, so you don't have that issue with the blood glucose. Even healthful foods like cooked carrots, cereals, potatoes, breads, and rice can have a higher glycemic index, which means a rate at which foods are converted to sugar and trigger a rise in insulin than table sugar. So we have to be very careful about those foods, especially if you're dealing with those issues. So in the meantime, a simple test would be to have a breakfast of fruits and cereal one morning and see how it lasts by observing your energy and mood. If you notice that you start getting cranky, you start getting tired, mood swings, then you know that you possibly could have some insulin resistance issues. Then the next morning, have eggs, Canadian bacon, or another meat the next morning, and then again monitor your feelings and energy level every half hour for about 4 hours and see how you're doing. Now, that is a start in getting to know if you are a fast or slow metabolizer, and the fast ones feel dreadful on healthful fruits and need longer lasting fats and proteins to sustain them. So, if you do that experiment and you see that you're really struggling with the fruits and the cereals, I recommend that you don't do cereals. But if you're doing like fruits or more carbohydrate intensive foods and you just feel awful after, then you may want to look at switching to the ketogenic diet. No, you don't have to be among the 135 million diabetics to benefit from these remedies. You may be unknowingly among the millions who are robbed of their vitality by Syndrome X or this insulin resistance. So check out in the description below, there's a free 28-day ketogenic guide that has everything laid out for you so you can get started. All you have to do is just put your email and then we'll send it over to you so that you can try that out and see how you do. So I'm really excited to hear your results. Now, if you found this information helpful, then please help me achieve my mission of helping as many people as possible by hitting the like button and subscribing to the channel. Share it with your family and friends or anybody who needs to hear this message or may be struggling. And then lastly, be sure to check out the free resources. Again, they're in the description with all of the other information and the highlights from the video. So thank you so much for watching, and I'll see you next time. Bye.